Hello, my name is Sharon Dei-Tumi, and I'm here to share with you my experience as an international student in podiatry. So I'm currently a third-year podiatric medical student at Temple University in Philadelphia, and I'm also from Ghana, West Africa. So a lot of times when people ask me why podiatry, I basically remind them that everyone needs their legs and their feet to move from one place to another, and there's nothing more annoying than trying to go for a beautiful walk or just enjoying a normal day and just having your feet hurt so badly. But that's not all podiatry is about. So for those of you that do not know, podiatry is a specialty in medicine that focuses on issues that affect the lower limb, so the lower limb being the hip to the toe. So as a podiatrist, you can work clinically as a clinician, and in doing so you'd work with patients with things like wound care, if they have any dermatological issues like skin problems, eczema, psoriasis. You work with diabetics to make sure that they are not losing sensation in their feet, or if they have lost sensation, that they are not developing any ulcers that can lead to amputations. As a clinician, those are all the things you can do, and you can do that in different age groups. As a surgeon, podiatrists can also help patients who have fractures. So for example, if someone falls from a tall building and breaks their heel bone, podiatrists can help with that operation. If someone was born with a club foot or any form of birth defect of the lower limb, podiatrists can help with that. And so it's just like a very healthy breadth of things that we can do as podiatrists. So that alone is like a no-brainer to me if you want the best of both worlds in that sense. So when it comes to challenges that we face as international students in podiatry, two things really come into mind. The first one being representation. So like I mentioned, the field of podiatry is lower limb to toes, and however here in the US, different states have different scope of practices for physicians. So for example, in one state, a podiatrist might be able to do surgery up to the knee, but in another state, they might only be limited to the foot. So even within the US, there's that limitation. So now we get internationally, some countries don't even recognize the DPM degree. Some countries, on the other hand, also fully recognize and allow DPMs, which DPM being the degree that podiatrists get, allow us to practice, as much as we've been trained to do. So when, just like any other minority group, representation matters, because when I take my training back to my home country or to another country, and another one comes in, another podiatrist comes in, and the government starts to see that, wow, like these people can actually do these things, which are very helpful to our people. That's when the conversations start happening, and that's when the recognition starts happening as well. So the second limitation that I would share with you in today's very short video is funding sources. So every international student can relate to this. It's not just in podiatry, it's not just in medicine, but we don't qualify for federal aid. So this means that if you're not from an affluent family where your parents can pay out of pocket, a lot of the tuition, all of the tuition really falls on you. But thankfully, most schools have some form of merit scholarships that you can apply for. And a lot of organizations, well, not a lot actually, which is something that I found rather surprising, but a few organizations do have scholarship opportunities available and allow international students to apply. However, of course, those scholarships may not be limited to international students, so you're competing with other students, including US citizens. But under no circumstances should this be a hindrance to you, because again, it goes back to representation. Once you're able to get through, you might be that person that can start that fund for other international students to benefit from. So my closing message really is to all minorities. If you identify as Black or Indigenous or a person of color, I really want to urge you to continue your passion and to pursue your passion in medicine, because again, representation matters. If you're trying to apply into a program and you're looking and you're seeing that nobody looks like you, please don't let that discourage you from pursuing that dream, because if you don't start it and you don't become that face that someone else sees when they're applying, it's not going to start at all. If it has to start somewhere, it can start from you. So thank you so much for spending your time listening to me, and I really would love to help you if you need it. So please feel free to reach out and ask me anything. If I don't have the resources myself, I'll try my best to connect you with someone else who does. Thank you once again, and enjoy the rest of your day. Goodbye.